Welcome to the Office of Provider Development Support Coordination Enhanced Case Management Training. This training is designed to help you understand what enhanced case management is and how it works. Commonly used acronyms that you may see throughout the training are listed here. Let's look at the definition of enhanced case management. This is a more intensive level of support coordination provided for people who are recipients of the DD waiver, who meet certain criteria that identify certain situations that history and evidence-based practice indicates increased risk for the individual exists. Enhanced case management requires more active support from a support coordinator, including face-to-face visits monthly and monitoring of services to ensure that the individual remains stable or does not further deteriorate. ECM includes people on the wait list with CCC+. So let's look at timelines. If an individual qualifies for enhanced case management, these face-to-face contacts must occur monthly with no more than 40 days between visits, consistent with the settlement agreement requirements. And this gives CSBs more flexibility as to when to conduct the visits, so the timing does not become predictable. Effective March 6, 2013, CSBs were required to provide more frequent case management support coordination face-to-face visits with individuals who meet certain criteria. Specific operational guidance on how to implement the case management requirements of the settlement agreement, including the more frequent face-to-face case management visits, enhanced case management, for certain individuals, were contained in the Case Management Operational Guidelines, which was developed by a committee of CSB, DD waiver, and advocacy community representatives. The settlement agreement between the United States Department of Justice and the Commonwealth of Virginia contains specific requirements regarding the provision of case management services, including monthly face-to-face meetings, no more than 40 days apart, with individuals who meet certain criteria, A through G. This level of case management, known as enhanced case management, assures the health and safety of individuals who fall in criteria A through G as identified in this PowerPoint presentation. There are 7 identified criteria that require enhanced case management. For individuals on your caseload, ask yourself, have they 1. Transitioned from a training center within the previous 12 months, 2. Received services from providers having conditional or provisional licenses, 3. Have an interruption of services greater than 30 days, 4. Have an inability to access needed therapeutic services, adaptive equipment, or modifications, 5. Have an encounter with the crisis system, including risk triggers, the criminal justice system, or adult protective services involvement. 6. Reside in a congregate setting of 5 or more individuals. Or 7. Are any items under 1A or 1B scored with a 2 on the SIS? If the case manager support coordinator cannot complete the required face-to-face contact, they must document the reasons and all attempts. After 2 consecutive 30-day periods of no contact, the CSB case manager support coordinator will advise their supervisor and contact their regional CRC, which is Community Resource Consultant, who will determine if further steps are needed, such as contacting the licensing specialist or DMAS. This includes vacations the individuals and families may take. The CSB Case Manager Support Coordinator must also comply with the established waiver request to retain slot process as appropriate. So let's look at face-to-face visits and timelines. Visits must occur monthly with no more than 40 days between visits. So for example, a visit on March 2nd occurs. The next visit is due on or before April 11th. There are 40 days from March 2nd to April 11th. Each ECM criteria is further defined in this presentation to include any exemptions allowed. If an individual meets an exception in one category, but meets ECM in another category, then ECM criteria is met and ECM face-to-face visits continue until no ECM criteria is met and the individual has been stable as defined for 90 days. The individual's case manager support coordinator shall initiate enhanced case management and meet with the individual face-to-face at least every month with no more than 40 days between visits. And every other visit must be in the individual's place of residence in their home for any individual who meet criteria. The Office of Provider Development has created an enhanced case management worksheet. Its use is optional, but we believe it may be helpful as you work your way through determining if someone is eligible for enhanced case management or ECM. Each criteria is presented with relevant questions, and once answered with a yes or no, will give you a determination on eligibility. It is important to note that you must go through each of the criteria each time to be accurate. If you have questions about where to get this optional worksheet, the corresponding questions and answers, or anything related to ECM, please contact your community resource consultant listed at the end of this presentation. Let's begin by looking at the first criteria, Criteria A, which is Training Center Transition. Criteria A relates to if the individual has transitioned from a training center within the previous 12 months. If so, the following apply. The support coordinator case manager shall meet with the individual at least every 30 days, with at least one such visit every 60 days in the individual's residence. In other words, in the residence every other month, for 12 months post-training center discharge. The support coordinator case manager shall ensure post-move monitoring reports are sent to the DBHDS post-move monitor for 30, 60, and 90-day visits, plus notes for the first full year following discharge. And for any change in residential or a day support provider, the post-move monitor is to be made aware of the change, and the new provider needs to be aware of the individual's specific transition plan provided by the initial post-move monitoring visit. Please note that the post-move monitor will conduct monitoring at 3, 10, 17, and between 30 and 45 days following a training center discharge. The Office of Human Rights conducts visits at 60 and 90 days. Remember that visits must occur every calendar month with no more than 40 days between visits. The support coordinator case manager can use the ECM worksheet, which is optional, to help determine if ECM is required. In completing this form, you must answer each criteria to determine if ECM is required. Please note that stable is defined as pre-injury or illness condition and functioning, or the individual has reached post-injury illness condition or optimum functioning as determined by a licensed medical professional, a nurse practitioner, a registered nurse, or physician's assistant. Now we will discuss Criteria B, providers operating under a conditional or provisional license. In criteria B, if an individual receives services from providers having a conditional or provisional license, please note the following. The case manager support coordinator shall fulfill face-to-face obligations for the entire time a provider is on a conditional, i.e. a new license, or provisional license. This level of face-to-face contact will continue for at least 90 days after a provider has been removed from the conditional or provisional status. This requirement for more frequent case management support coordination visits applies to any individual receiving services in any of the DD waivers who receives services from any DBHDS licensed provider that has been issued a conditional or provisional license. The DBHDS Office of Licensing will post information on the DBHDS website, updated monthly, about each provider that is operating under a conditional or provisional license. Criteria B on the ECM worksheet asks if the person receives services from a provider with a conditional or provisional license, and if so, has 90 days passed since the removal of the conditional or provisional license. Using the link in this slide, you can find information regarding providers who are operating under a conditional or provisional license. Next, we will discuss criteria C, interruption of services for 30 days or more. An interruption would be considered a break in an authorized service due to factors beyond the individual's control, such as programmatic issues, staffing, or medical events that led to the break in services. An individual choosing not to attend or participate in a service is not considered an interruption. The following waiver services are the only services that apply for the interruption of services for 30 days or more. Congregate residential, including supervised and sponsored residential, in-home residential, personal assistance, either agency-directed or consumer-directed, supported employment, and day services. Please note for supported employment, a change in a supported employment job site, but not a provider, does not constitute an interruption in service. Use the worksheet to assist in determining eligibility for ECM. Each ECM criteria must be assessed to determine if an individual continues to meet criteria. Please note, a vacation when the individual and his or her family are out of town does not constitute an interruption of service. Vacations must be clearly documented in the individual's record. Also, if a person chooses to stop a service or quits their job, this does not meet ECM criteria C under interruption of service. If a person is choosing to pause or end services, ECM is not required under this criteria. Our next criteria, criteria D, relates to the ongoing inability to access needed services. The question to ask in this criteria is if there is an inability to access needed therapeutic services, adaptive equipment, or modifications. Have needed services been identified, or is there an ongoing inability to access these services? Use the worksheet to answer each question to determine if the individual meets criteria for ECM. We will now discuss criteria E and look at if the individual has encountered the crisis system or medical health system. Crisis includes behavioral, psychiatric, and medical events and serious incidents. Crisis means admission or assessment for admission to a crisis stabilization unit, emergency services, children's services, or REACH services, a hospital, other than for routine or elective procedures, and emergency room visits, a hospital followed by admission to a long-term rehabilitation or skilled nursing facility, or any of the following risk triggers: diagnosis of aspiration pneumonia, bowel obstruction, seizures, decubitus ulcer, a pressure sore, a UTI, seizure, a fall, or sepsis. Crisis includes behavioral, psychiatric, and medical events and serious incidents. Any crisis event includes the need for the support coordinator to document the issue, convene relevant team members, revise the ISP, report suspected abuse, neglect, or exploitation to Adult Protective Services, Child Protective Services, the Office of Human Rights, whoever's appropriate, and to the Office of Licensing as defined in licensing regulations, and document the resolution. ECM visits continue for 90 days after the person is stable, not 90 days after the crisis event. When an individual has an encounter with Adult Protective Services or Child Protective Services, or involvement of the criminal justice system or incarceration, they typically would qualify for ECM as a result. In some individual situations, the individual may meet one of the crisis system criteria, but the support coordinator case manager may review this with their supervisor to determine the need for an exception to ECM. For example, if a family member routinely uses the emergency room for non-emergent care rather than the primary care physician, despite repeated efforts by the support coordinator to encourage the family to use the primary care physician for routine care, it is expected that these situations will be infrequent and should clearly document supervisory review and why an exception is being made. If an exception is appropriate, the support coordinator must still review all criteria before determining if the individual qualifies or not for ECM. On the worksheet, consider all criteria A through G and answer each question independent of the next. In this example, the individual does not meet criteria A, B, C, or D, but does for criteria E. They have not recovered from their crisis or medical concerns and have not been stable for at least 90 days, so they would continue to qualify for ECM until they are. Let's review criteria F. Enhanced case management support coordination visits are required for individuals who live in a 5-bed or greater group home. Please note this means that the provider is licensed for 5 or more individuals. Exceptions to this criteria include if no other ECM criteria is met except that the individual lives in a 5-bed or larger group home, and the individual's medical behavioral condition is well controlled and well managed, stable by definition, for the past year as described below, then ECM is not required. Individuals who have been identified as being at risk for serious injury and/or death due to a specific condition or event, and medical and behavioral conditions are well controlled, due in part to safety protocol and mitigation plans being in place, ECM is not required. In using the worksheet, Each question under each criteria is answered to determine if the person qualifies. For the exceptions to criteria F, answer all 3 questions to determine if an exception exists. Please note, criteria G must also be completed. The final criteria, criteria G, is related to SIS scores. The individual shall receive Enhanced Case Manager Support Coordinator visits while Sections 1A or 1B of the SIS Supplemental Risk Assessment remain scored a 2. Under criteria G, you are asking if there are any items under the SIS 1A or 1B scored with a 2. Exceptions to this criteria include when the SIS is the only criteria met, ECM can stop if the person has been stable for the past year. If the only identified risk is related to falls, ECM can stop after 90 days without a related incident. Exceptions to this criteria also include the following. Related to lifting and transferring, if the individual has not experienced an injury as a result of an adverse event in the context of lifting or transferring in the past 90 days, then ECM is not required. However, if the individual has experienced an injury as a result of an adverse event in the context of lifting or transferring in the past 90 days, then ECM is required and will continue 90 days after the individual is stabilized. If the only item scored, a 2, is related to receiving therapy services on the SIS 1A number 15, then ECM is not required. We mentioned previously that individuals who have been identified as being at risk for serious injury and/or death due to a specific condition or event, and medical and behavioral conditions are well controlled, due in part to safety protocols and mitigation plans being in place, may not need ECM. Safety protocols, mitigation plans, which include health and safety outcomes, risk protocols, and behavior plans, are in place and evidenced by no serious injuries or crisis has occurred in the last year. The ISP includes safety protocols and mitigation plans for the identified intensive medical and behavioral need. Safety protocols, mitigation plans are followed by the provider and/or the family member or support coordinator, reviews provider documentation of safety protocols and mitigation plans as evidence that safety protocols and mitigation plans are in place and implemented as written. The safety protocols mitigation plans, again, health and safety outcomes, risk protocols, and behavior plans, are reviewed quarterly and revised as needed, and the ISP is updated as appropriate. And the final area, if there are no other risk triggers or changes in medical or behavioral conditions that have been identified that would put the individual at risk, again, that includes diagnosis of aspiration pneumonia, bowel obstruction, decubitus ulcer, a pressure sore, urinary tract infection, seizure, falls with an injury, or sepsis. There may be an exception. Examples of significant changes in conditions or events related to an individual's risk include any change in health or behavioral status, change in medications, especially as the side effects may impact the risk. For example, dizziness may contribute to falls. Dental work as it relates to someone who is already at risk for choking, as it may lead to aspiration pneumonia, dehydration or constipation, as it may lead to bowel obstruction. As long as no other risk triggers have been identified, an exception can be made. Stable is defined as pre-injury illness condition, functioning, or the individual has reached post-injury illness condition or optimum functioning as determined by a licensed medical professional, a nurse practitioner, a registered nurse, or physician's assistant. For the documentation of stability, please note, while in writing from the professional would be preferable, documentation by the support coordinator is sufficient when it includes the details of the conversation with those involved and confirms that a professional made the determination. As a support coordinator, there are requirements that you must follow when providing enhanced case management. Document in the record the status of the current identified issues and any newly identified issues to include the status of the individual related to current ECM criteria met and any newly identified ECM criteria met. Convene and mobilize person-centered planning team members for any change in status to address the issue and revise the ISP as needed. The meeting will include the individual, guardian authorized representative if applicable, support coordinator case manager, and any applicable providers. The planning meeting can be in person, by a conference call, or by support coordinator case manager individual phone calls to all parties. Report suspected abuse, neglect, or exploitation to Adult Protective Services or Child Protective Services and the DBHDS Offices of Licensing and Human Rights. Report to the DBHDS Office of Licensing any serious incidents or injuries as defined by licensure. Document support coordinator actions to address and resolve issues and resolution of identified issues in the case manager support coordinator record. Let's look at a couple scenarios and examples to ensure understanding of ECM services. In our first scenario, the person meets the 1A, 1B criteria due to medical support needs. They have a J-tube and a seizure disorder, but have been medically stable for the past 6 months. They reside in a sponsored residential home. A ceiling lift has been recommended by their therapist, but there is difficulty getting it authorized under the waiver due to their sponsored status. Insurance will not cover the device because it is a covered item under the individual's waiver. Would this be considered ECM with the lift being in limbo? And would they remain this way until resolved? Our answer is yes. The inability to access needed therapeutic services, including behavioral consultation, assistive technology, and/or modifications, qualifies the person for ECM until services have been obtained. Let's take a look at Marie. Marie is receiving supported employment and sponsored residential services. Supported employment has not been able to reopen due to COVID limitations and restructuring issues the agency is going through. Does Marie need to be ECM for the continued interruption of services? The answer is yes. An interruption in supported employment services for this reason does qualify her to receive ECM. A referral to DARS and the choice of another supported employment agency may be warranted. Our last example. Does a person automatically become ECM if an assistive technology environmental modification need is being requested or has been recommended by a therapist? And does ECM end once the person has received the item? Yes. The inability to access needed therapeutic services, including behavioral consultation, assistive technology, and/or modifications, qualifies the person for ECM until services have been obtained. The need for assistive technology and environmental modifications would need to be identified by a qualified professional. If the AT and EM need is identified by a therapist as necessary, ECM would be required until the need for the equipment is secured. When determining when you are able to stop enhanced case management, please consider the following. For interrupted services having resumed, you can immediately stop. If needed therapeutic, adaptive, or modifications have been secured, again, you can immediately stop. For situations where the provider no longer has a conditional or provisional license, the person only met criteria for a fall risk and has been without injury, they have been stable following medical or a behavioral crisis, Adult Protective Services or Child Protective Services involvement has resolved, and incarceration has ended. For any of these, after 90 days, ECM may cease. If you have a person and the only criteria is related to the SIS and they have been stable without new needs being identified, or the person has been in the community following a move from a training center, or the only criteria is living in a 5-bed home and they have been stable, after 12 months for these three, you may cease enhanced case management. If you have any questions regarding enhanced case management, please contact your CRC on Team 3 in your region. The DBHDS website provides contact information for the Office of Licensing, Office of Human Rights, and the Division of Developmental Services. Community resource consultants with the Division of Developmental Services are available in each region to assist with questions about the DD waivers. Additional contacts are available on the DBHDS website at the link provided. We thank you for participating in this enhanced case management training.